Hey guys, it's Marshall and Ann from PhysioU, and today for Mentoring Minutes, we'll be talking about classifying low back pain according to the movement system guidelines. So Van Dillen and Sarman, Dr. Van Dillen, Dr. Sarman out of WashU, took 185 patients with chronic low back pain and performed 7 primary tests on them. And we'll go over those in just a second. And any of the tests that increased symptoms, they repeated with the secondary test, a corrected test, making the lumbar spine in a more neutral position, and then seeing which symptoms, if symptoms decreased. For the extension group, the 3 tests that they found were returning from forward bend, so as the patient bends forward, as they come back up, you see early or too much extension, which reproduce symptoms. It's going to go back down, and had the patients think about coming up using hip extension versus lumbar extension. The secondary test was the prone position. First, they just assessed patients laying prone. If that increased their symptoms, they placed the pillow underneath their stomach, placed the lumbar spine in a more neutral position. And thirdly, they put them in quadruped. Again, just observe their normal position, resting position. If that brought on symptoms, they corrected them to a more neutral position. For the rotational category, they used seated knee extension. Again, just having the patient kick their leg out, see what happens. Increased pelvic and lumbar rotation, brought on patient symptoms. Asking the patient to control that motion, either with therapist's hands or the patient's hands. Instructing them to tighten their abdominals to help stabilize the back. Next, go ahead and lie on your back. They looked at bent knee fallout or hip abduction, external rotation in supine. Again, having the patient move their leg out towards me and seeing the pelvis and back rotate. Secondary test would be to correct that, so having them stabilize it with their hand or using their stomach muscles, and just make them aware of their pelvis bone. And you can have them move their leg out, trying to keep this in neutral. And then lastly would be in quadruped. Get in a resting position in some rotation, or having them rock backwards. As they rock backwards, you see an asymmetry. Again, that brought on patient symptoms, correcting them to a more neutral position. So either guiding them as they rotate back and come back up. You go ahead and do that on your own. Perfect. For the flexion group, they used the forward bend test. Again, you're looking for a lack of hip flexion and excessive lumbar flexion, which she is the best patient for. She actually gets plenty of hip flexion. But pretend there's an excessive flexion bend here, brought on patient symptoms. The way we want to correct it is encourage more of a hip hinge, get to that 70-degree angle, and come back up. The second test they used was the seated knee extension again. Again, as you observe her kick her leg out, she goes into a posterior tilt and lumbar flexion. If that brought on patient symptoms, they controlled that motion to keep them more in a neutral spine position. And then lastly was in the quadruped position again. And again, they looked at just resting position to see if they were hanging out in too much flexion. If that was painful, they brought it more to neutral. And then watching them rock backwards. And again, as they rock backwards, going into more lumbar flexion versus hip flexion, and then teaching the patient to correct that motion, keep them in neutral, and then rock back, utilizing more of a hip flexion angle. Okay. So to recap, for extension, it was return from forward bend, prone, and then the quadruped position. For rotation, it was seated knee extension, supine bent knee fallout, again the quadruped position and rocking back. Then for the flexion group, it was forward bend, again the seated knee extension test, quadruped, and rock back. As all good tests that can help you identify which subgroup to go into for your movement system impairments. So in conclusion, of those 185 patients that they used, 95% of them had an increase in symptoms with at least one of the tests. The forward bend test had the most amount of reproduction of symptoms. Over 50% of patients had symptoms, while the quadruped test had only 23% of reproduction of symptoms, so it had the least amount. So we can kind of use those based on patient's irritability. We need to go just to position of comfort, or maybe a test that helps us identify a classification and they're pretty irritable. Now, if we fast forward 6 years from when that article came out, Dr. Sarman and Dr. Van Dillen put another article in that actually looked at the correction tests and how helpful they were. And what they found was with the patients, again, they put them through the primary tests, and about 82% of the secondary tests were actually beneficial to decrease in symptoms. So the nice thing is, we have these tests that bring on symptoms, and they're just movement tests, watching people move. But yet we also have tests that are researched to help decrease symptoms, these secondary tests. So we can use them in our examination as well. All right, hope you guys enjoyed. I know it was a little bit longer than normal, but until next time, take care.